Hi there and welcome once again to MagicATL.com. I'm Carol Blackman. Today we're talking to Dr. Frederick Schnell, radiation oncologist at Dekalb Medical at Hillandale, and we're going to focus today on prostate health. Welcome.
Thank you, Carol.
We were talking off mic just a moment ago about prostate care and maybe men not really knowing much about what that is, or prostate, not knowing what that is. Is that really possible?
Well, I think that a lot of men don't necessarily concentrate on their health as much as perhaps women do. Okay. You hear a lot about breast cancer and screening and mammograms and women taking care of their health, whereas men are probably tougher and more macho and aren't as concerned about their health as much as women are, since we don't necessarily feel like we're, or we want to feel invincible, really.
When should men actually start getting their prostate checked? At what age? And then after that specific age, how often? Yeah,
that's an excellent question. These days, the recommendations have been for men 50 years of age and older to begin screening. However, African Americans and folks with a family history should really begin at the age of 45, and those with an increased risk or with family members that are younger should actually begin screening at the age of 40. So, you know, it varies depending on the group, but African Americans really should begin screening at an earlier age, since there's a higher incidence of prostate cancer and also of the aggressive types of prostate cancer.
And why is that, doctor?
We're not really sure, other than it's genetics. So in the African American population, it's found more frequently than in the Caucasian population, and they tend to be more aggressive. So screening should be done earlier, probably at the age of 40 to 45.
So what are some of the causes and symptoms, and then some of the practices as far as care is concerned, where prostate is concerned?
You know, the two main risk factors are age for men. So as men get older, we are at increased risk for prostate cancer. The majority of men will develop prostate cancer over a lifetime, although not all prostate cancers are aggressive to where they spread or cause problems for patients. So the question these days is which cancers are aggressive that need to be treated versus those that can undergo active surveillance or sort of a watch and wait approach, so that we don't cause symptoms from our treatment
And what are those?
Well, when patients get treated for prostate cancer, whether it's surgery or radiation therapy, we can cause urine problems or sexual dysfunction, since the prostate gland is a part of the male reproductive system. And when patients have surgery, patients might leak urine. If they have radiation therapy, they might go more frequently. So the symptoms are different, but can cause problems with urine function, as well as sexual dysfunction or erectile dysfunction.
What are some of the ways prostate cancer can be avoided, prevented?
You know, it's difficult to avoid it. In this country, it's very common to develop prostate cancer. It's the most common cancer in men. In the United States, we have the highest incidence of prostate cancer than anywhere else in the world.
Wow, I didn't know that.
So it could be our diet or other factors, environmental. It hasn't been pinpointed as of yet, but the incidence is much higher in this country than in other countries.
Can a man lead a normal sex life with either prostate cancer or enlarged prostate disease?
Yes, men can still lead active sex lives after being diagnosed with either prostate cancer or BPH. Typically, BPH won't affect sex function unless there's some compromise of the nerves for some reason, but with treatment for prostate cancer, that's where we run into the problems with erectile dysfunction. Men who have surgery might have the nerves cut and not be able to develop erections, or with radiation therapy we also see erectile dysfunction there as well. But there are medications such as Viagra and Cialis that might help keep men able to perform and be active sexually, but it can be a problem with treatment. So if we can avoid treatment, that would be nice, and if you need it, then there's always some risk for sexual problems.
So in a nutshell, give me just 3 takeaways for our men visiting us on the website today about prostate care?
It's important to undergo your screening, get a PSA checked, a digital rectal exam, see your physician, especially as we get older in our 40s and 50s, so that we can find prostate cancer or any other problems with our health earlier instead of later. Do your research when it comes to being diagnosed with prostate cancer. There are multiple ways of treating prostate cancer. Some have side effects that might be avoided versus other types of side effects that might be detrimental to your particular case. And the third one perhaps would be another takeaway.
I believe you said even getting tested, well, getting their screenings, you said early at 40 and maybe 50.
Well, depending upon your family history,
right,
and whether you're African American or not, beginning at the age of 40 to 45 versus older for prostate cancer screening.
Okay. Thank you for all this great information. And now the women, we just have to be able to get through that machismo with the men and get them to the doctor to see you.
I think so. I think so.
Yeah, yeah. So thank you, Dr. Schnell.
Thank you very much.
And he's a radiation oncologist at Dekalb Medical at Hillandale. Appreciate you so much. And thank you for visiting us on MagicATL.com, powered by Black Planet Radio.